this vaccine. Over the last 24 hours, we have identified 1,429 new cases of COVID-19 and completed about 15,000 tests. Our positivity rate currently stands at 9.4%. There are now active alerts or outbreaks in 414 schools, which represents 17% of all schools in the province. There are now 340 people in hospital being treated for COVID-19, including 83 in the ICU. Sadly, 3 new deaths were reported to Alberta Health in the last 24 hours. It might be tempting to forget that each of these numbers is a person, but we cannot let ourselves become numb to these statistics. My sympathies go to all those in hospital, in ICU, and the loved ones of those who have died, as well as anyone who is mourning a death from any cause right now in these difficult times. Today I want to talk about variants. We have identified 717 additional cases of variants of concern in the last 24 hours. Variants currently represent about 45% of our active cases. I know that many Albertans feel information overload about variants, and others have many questions like how contagious variants are, whether vaccines will work, and what we can do to limit onward transmission. To date, 3 variant strains have been detected in Alberta that have us concerned. The B.1.1.7 variant, first reported in the UK, the B.1.351 variant, first reported in South Africa, and the P.1 variant, first identified in Brazil. These variants are still new, but what we know from current evidence is that these 3 variants of concern are more transmissible than the earlier form of the virus. The B.1.1.7 seems to be about 50% more transmissible, and P.1 seems to be closer to twice as infectious. Each of these variants of concern also have some unique properties. The B.1.1.7 variant seems to be able to cause more severe illness than our original strain. At this point, it's not clear if the other 2 variants also have increased severity, or if some of the severe outcomes being reported in countries where they are the dominant strain are due to the high burden of disease because of how infectious they are. One of the biggest questions is how well our vaccines protect against these new variants of concern. The good news is that all 3 vaccines we currently have available are effective at stopping the variant that's most common in Alberta, the B.1.1.7. Evidence is less clear right now about the other 2. Vaccines seem to have a somewhat lower effectiveness against infection with B.1.351 variant, although they still may provide protection against severe outcomes. For P.1, evidence is mixed, and it isn't clear whether there will be a vaccine effectiveness impact. Our knowledge and understanding is rapidly evolving, and we'll know a lot more in the time to come. That's one reason we're keeping measures in place right now, even for people who have gotten a vaccine. So if variant cases are more infectious and maybe even deadlier, what are we doing to slow the spread? First, we implemented the health measures announced on Tuesday. These variants spread by being in close range of someone who is infectious, particularly indoors, just like all other COVID-19 strains, which means that the fewer in-person interactions we have, the less chance they have to spread. Our labs also continue rising to the challenge. Despite rising cases, we continue to screen every positive COVID test for variants of concern. Early on, Alberta Health Services formed a dedicated contact tracing team to address variant cases, putting its most experienced and knowledgeable contact tracers to work limiting spread. These steps are a big part of why we were able to slow the growth of variants over the last few months. However, we have now reached the point where variants of concern are the dominant strains of new COVID-19 cases in our province. By far the most common is the UK variant, or B.1.1.7, which makes up 99% of all of our variant cases confirmed to date. We have now reached the point that if you test positive, you should assume that you have the UK variant. Because of this, we are now focusing the efforts of our specialized variant contact tracing team on the P.1 and B.1.351 variants, and we will be treating cases and contacts of B.1.1.7 and the original COVID strain the same going forward. With that in mind, effective today, we will begin offering testing twice to close contacts of all confirmed cases, regardless of what kind of COVID strain they may have been exposed to. If you are a close contact, you will be offered testing as soon as you are notified, and if you test negative, offered testing again 10 days after your last exposure. By testing all close contacts twice, we have a better chance at quickly identifying new cases and stopping their spread. Effective immediately, we are also aligning our isolation requirements for original COVID and B.1.1.7 cases. We will continue to strongly encourage all new COVID cases to isolate away from other household members in isolation hotels or other appropriate separate accommodation. However, for original and B.1.1.7 variant cases, if a case has a separate bedroom and separate bathroom and remains completely separated from the rest of their household for their infectious period, we will consider the 14-day quarantine period for household contacts to begin on the last day of contact with the case. If the case cannot isolate in a separate space from the rest of the household, and for all P1 and B.1.351 variant cases, we will continue to consider household contacts to be continuously exposed during the infectious period if a case remains in the same house, even if they have a separate bathroom and bedroom. To be clear, the quarantine period of 14 days after the last exposure to an infectious case remains the same. It is just the home isolation approach that is a little bit different. I recognize this puts an additional burden on Albertans, especially for parents and guardians of children who can't isolate away from their infectious or exposed child. That's why supports, including hotels, are available for anyone who needs help isolating away from where they live or quarantining away from an infectious case. Details about this program are on alberta.ca and available by calling 211. Along with these stricter measures, there is a small bit of good news. Last month, I signed an order requiring extra testing and aggressive measures for all variant outbreaks in continuing care facilities. Thanks to vaccines, we have seen that these additional measures are not necessary in sites with high vaccine coverage. As a result, I am rescinding that order so that tough outbreak protocols will be implemented only when local medical officers of health deem it necessary. This pandemic has been hard on residents in these facilities, and this is a small step to avoid making it any harder than necessary. Finally, I know that many people wonder what they can do to stop the spread of these variants. The answer is not new, but it is more important than ever. Limit your time in contact with other people, especially indoors. The new restrictions announced last Tuesday will bend the curve even for variant strains if we all pull together. We all need to follow them, and the old advice we have heard so many times is still true. By washing our hands, wearing a mask, staying physically distanced from those outside our household, and staying home when sick, we can stop the spread of COVID. When wearing a mask, make sure it fits well and snugly around your mouth and nose. Double masking is one way to ensure a snug fit, but there are other ways as well to ensure that masks provide the best protection. For example, make sure that reusable masks have at least 3 layers, with one of them a non-woven material. If you need to wear a mask for a full day, ensure that you change it after several hours of continuous use and if it becomes dirty or saturated. Always clean your hands before putting on a mask and before and after removing it. The most important thing that we can do is to be vaccinated as soon as we are eligible. The best way to limit the long-term spread of these variants and all COVID-19 is to book our vaccines as soon as we are eligible. While research is still ongoing to understand how vaccine effectiveness may differ with variants, we know that every vaccine provides more protection than no vaccine at all. That's because these vaccines elicit a broad immune response, so changes or mutations in the virus are not likely to make vaccines not work at all. These vaccines are also easily adapted, and the manufacturers have already begun testing and adapting vaccines to improve future doses, specifically for variants of concern. All of this means that by getting immunized and reducing spread, we can win this fight. We can protect each other. The variants are an unfortunate reality, but we have the tools to stop them. We can see the end of the tunnel getting closer, so let's all work together to get through this as safely as possible. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Thank you. The first question is from Helen Pike, CBC Calgary. Please go ahead.
Hi, thank you so much. There are a number of restaurants and gyms, some in smaller communities, one in Calgary, a number of gyms in Calgary, and announcing to their patrons that they will not be complying with the health restrictions that were announced. I guess, what is the action plan for this? Are we enforcing our way out of this? What can be done?
We are having ongoing conversations with colleagues on the front line with respect to the response to what we will see in the coming days and weeks. What I would say to those individuals who are planning on defying the public health orders, or those patrons who may attend at those locations, I would ask them to consider our current situation. It's important to remember that, for example, in the 2009 influenza pandemic, the height of our ICU occupancy for influenza H1N1 in 2009, which was a novel influenza, was 35 cases in ICU at any given time. We now have over 80 people in our ICUs, and the numbers will continue to rise as our case count rises. This is something that is extraordinary, and we need everyone to pull together in order to turn the tide and in order to save our healthcare system, to protect our fellow citizens, or those in our communities, not just from COVID-19, but also to make sure that healthcare capacity is there for those who need it for any cause. And those are the kinds of things that I would ask all those who are feeling upset and frustrated about these restrictions to consider the consequences of their actions and the consequences of further spread of COVID-19.
Helen, is there a follow-up question?
Yeah, just to follow up, in light of AHS shrouding up Grace Life, is this a measure that could come into play with these businesses that are saying that they will stay open?
We know that there will be, again, some businesses who are feeling frustrated, and of course it's important for them to have the benefit of the information that's provided to all businesses that aren't following public health rules. But there is a graduated enforcement pathway, and so there are multiple different tools that our frontline teams and law enforcement officials have at their disposal. And again, it's not, I think, in all of our interests for those businesses to put others at risk in their communities. So I would just ask them to think very carefully about their actions and realize the consequences are, again, pointing back to health system capacity, preventable deaths, and that staying open essentially is putting their communities at risk.
Operator, could you put through the next caller, please?
Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. I just want to follow up on the question you just answered. How does it make you feel when you see businesses and even government MLAs saying they don't believe in the public health measures that you are proposing to keep people safe?
I think that, to me, what it means is that people look around and they haven't perhaps been personally impacted by a severe outcome of COVID-19. And in some ways, that's a measure of our collective success. We have managed to bend the curve down multiple times. We have managed, although we had severe pressure in our healthcare system in December, we have managed to keep it from overwhelming our capacity. And so I think that the perspectives that are being shared are a reflection of how frustrated people are feeling of having to go into these measures yet again. So while it's understandable, and again, in some ways a measure of the success of our measures from getting to that worst place outcome that we have seen in other countries, I would again call on people to look at the evidence, to look at what's happened in other countries when COVID-19 and variants in particular have gotten out of control, and to remember that it is now that we have to act. If we wait to act until our ICUs are overflowing, it will be far too late.
Kevin, is there a follow-up question?
Yeah, the government MLAs that are advocating against additional health measures have as much access to the information that you're providing as anyone in Alberta. They should be up to date on all of these things you're proposing. So what is your reaction then to them taking that information and saying, I don't agree with it, and advocating to their constituents if they don't agree with it?
Again, I suspect that it is a measure of looking around and perhaps not having been personally impacted by these severe outcomes. And I think that there are many different opinions with respect to how to navigate COVID-19. But what I am certain about is that without public health measures, without bending our case counts down, we will have a very significant impact in our healthcare system. And so, again, my reaction is to encourage all Albertans, those in positions of leadership and those in organizations, those who run businesses, those who attend those businesses, to think about their communities and to think about how part of the frustration is about the isolation and the challenges that the public health measures have brought to bear, and I understand that. But I think what we need to do right now is pull together and consider how we can support our communities to get through these difficult times, while at the same time following the legally required measures that are in place to protect our healthcare system and protect our communities.
Operator, could you put through the next caller, please?
Carrie Tate, Globe and Mail.
Hi, Dr. Hinshaw. Thank you for taking my question. I'm wondering, in light of the explosion of variant cases, whether there's any thought to rejigging the vaccine sequence, perhaps adding teachers or doing mass vaccinations at work camps up north, that type of thing.
The sequencing of vaccine is always an extremely difficult decision, and of course, as we planned our vaccine sequencing, we were looking at preventing severe outcomes. And if we were to consider changing how our sequencing rolls out, the important thing to remember is that in order to do any of those things that you've mentioned, we would essentially have to be taking vaccine doses away from groups that are at personal high risk of severe outcomes, and then offering them to other groups who perhaps, again, are in positions where they're not able to work from home, or they have some of those other risk factors you've mentioned. Individuals in work camps, teachers, individuals across the province in any occupation who have a personal risk factor, such as a chronic condition of high risk, they already can be vaccinated, and I would encourage them all to do so. And as we're looking at the rollout in 2C, part of those groups are exactly those groups where we have seen extremely large outbreaks happen very quickly. And so we have already taken that into account in our sequencing. And we know, again, that as soon as we're able to move through phase 2 and move into phase 3, where we're able to offer to many more Albertans, we will be able to broaden that protection. But again, it's a very difficult choice right now because we have a limited amount of vaccine, and any changes we make would essentially be taking away from one group in order to give to another.
Carrie, is there a follow-up question?
Yes, thank you. And even though right now we have limited data, do you have a sense of what the uptake is? How many people who are eligible are getting in the queue?
The most recent data that I've looked at shows that those who've been eligible for longer, so those in the oldest age groups of 80 plus or 75 plus, have the highest uptake, perhaps because they've had the most opportunity to receive a vaccine. So in those older age groups, we're seeing around 80% of those individuals who have already received a vaccine. We know some of them, again, we're working to make sure that we provide access to vaccines across the province, including in rural areas. But for some people, there may be barriers that we haven't been able to overcome yet. It's just last week that Alberta Health Services began rolling out their homebound immunization program. So again, we anticipate that that will continue to rise. And so that's the kind of uptake we've seen, again, in those age groups that have been eligible for the longest.
Operator, could you put through the next caller, please?
Lesser Kent, Global News.
Hi, Dr. Hinshaw. Yeah, I just want to circle back to the number of MLAs that had concerns about some of the health measures that were coming in. Whatever their motivations and the reasons for those concerns, do you have any? Do you fear that there's any kind of a danger when it's government leaders that are saying some of these things, and how that might influence their constituents and other people in the province?
So I think, again, that there is a diversity of opinion about the best path to take. But whether or not to actually follow the restrictions is a different question of whether or not someone fully supports them. These restrictions are legally required, and so it's critical, again, to make that distinction between what we all need to do, which is continue to have respectful dialogue and have conversations across groups who have different opinions, while at the same time following the legal requirements to be able to support our communities, to support our healthcare system, and to prevent the concern of future cases becoming these future hospitalizations if we do not turn that curve around.
Fletcher, is there a follow-up question?
Yeah, and just on the changes that you announced today, having the two tests, the assumption that these are variants and requiring the two tests, and what kind of difference do you think that might make in being able to get some of the variants under control?
Well, we've seen in the data previously that when people have a negative first test, if they become symptomatic after that, they have a much higher positivity rate. But even if they're asymptomatic, we still are identifying a small percentage of people on those second tests that we wouldn't otherwise have picked up. So the reason it's important is that somebody's in their 14-day quarantine period. If they test negative on that first test, they could still be incubating the virus, and they could still get sick again at that, day 9, day 10 point. And if they do, and if they don't have any symptoms, then they would actually be infectious as they leave that quarantine period. So that second test is really important to be able to make sure that that individual is not potentially passing that virus on to others. So that double test helps us with an additional layer of security around all close contacts of, again, all of our cases from today going forward.
The queue is empty, so thank you all for joining us. Dr. Hinshaw will provide another live update on Tuesday afternoon. Have a safe evening.